Hello, I'm with Yvonne Agazarian. Hi, Yvonne.
Hello.
So, do you want to give us a sense of what SCT is all about?
Yes. SCT stands for System-Centered Training or Therapy. And if it's SCP, it's System-Centered Practice. And it's a way of experiencing and observing the world through as if the whole world is a set of systems.
So as if the world is a whole set of systems, which is, something that seems a little theoretical, but
That's
on the
right.
other hand, you're also talking about experiencing, so it's like a mixture of these two components.
That's exactly right. It was started as a theory-driven system. So I developed the theory, and then something happened in the world, which was managed care came in. And when managed care came in, it was obvious that there was going to be a finite amount of time allocated for patients. Mm-hmm. And my knowledge is that there's really no way of telling how long a patient is going to need in order to reach the goals. And managed care was clearly going to interfere with that. So I thought then there needed to be a way of developing some kind of system of practice which enabled people to stop, and then start again with the same kind of therapy, not having to change styles of therapy, not having to change therapists. And if they did have to change therapists, it would be less difficult because the way the therapist worked would be similar.
Okay, so something that allows people to have therapy, stop, restart again, and a sense of being able to pick up where they left it.
That's right. That's right. So I then started to translate the theory into practice. Mm-hmm. And I started to see what it meant if I had the statement of theory, which is a fairly complex statement. It basically says a theory of living human systems.
A theory of living human systems.
Defines a series, a hierarchy of isomorphic systems. And isomorphy means that they are similar in structure and function. And why that is important is it means if I learn something about the system of you, the way you function and the way you structure is going to be the same as the system of me, the same as the system of us, the same of the larger systems we belong to, like a group mm-hmm. or an organization, mm-hmm. and the way all of those systems function are similar enough so that one can generalize what one learns at one level to every other level in the hierarchy.
So I want to bring it to a level, the way we're talking about systems, we're talking about groups, but in a way, because of the isomorphy, there's going to be something that you're going to learn in your person system
That's right.
and in the body.
That's right.
And so there's something very concrete where it relates to paying attention to the body as well.
Absolutely. In the practice that we've developed, we look at the stages of development in the system, and we predict that the system goes through the same stages of development. And then what we do is we reduce the things that get in the way of development. And this is systematic. Mm-hmm. And the first thing we do is we restore the relationship between the mind and reality testing. Mm-hmm. And the second thing we do is we restore the relationship with the sensations and experience in the body with the knowledge of what that brings, so that we start to get emotional understanding also. Mm-hmm. And then the third thing we do is start to reduce the defenses against frustration. Mm-hmm. So, et cetera, et cetera, et cetera.
So, for instance, when you're talking about the reality testing, do you want to talk a little bit more about how that happens in practice?
Sure. For each one of undoing the restraining forces, mm-hmm. there's a protocol or two. Mm-hmm. So how we undo anxiety is by saying, anxiety doesn't come out of the blue. It comes either from a thought, like a negative prediction or a mm-hmm. mind read, or from sensations in the body that arouse some kind of anxiety because they're unfamiliar, mm-hmm. or the edge of the unknown. Mm-hmm. So when you do that, then you can help people undo negative predictions. Then they come back to reality and reality test. You can get people to understand why sensations in the body are in fact upsetting them, when they're simply signals or information that the body is giving the self.
So I want to just take, for instance, this last thing you mentioned, the sensations in the body, and talk a bit about what happens, say, in a group, and how you encourage people to stay with the sensation and that notion of explore, don't explain.
Well, yes, but first, the way that any system-centered work works is by functional subgrouping, which means that people never work alone. So what they do is they say something, and then they say anybody else. And then the next person that speaks joins them and then adds something of their own. So nobody is alone. So if in a group we were going to undo, if we were going to legitimize sensations, one of the things that we might do is get the group to explore sensations they get when they get anxious. Then they're able to connect the signals of anxiety, like dry mouth, cold hands, butterflies in the stomach, lightheadedness, with the understanding that what's happening is anxiety. And then if they undo the anxiety, the systems subside.
Okay, so I want to bring it back. You mentioned the system, the idea of subgrouping, which is very important. So in an SCT group, people are not alone, and they're encouraged to subgroup, to find groups of people who feel similarly.
Well, it's a question of exploration. See, you mentioned explain, explore. Well, very important is if we explain things, we either tell stories or we talk about what we know already. Whereas if we explore things, we discover things that we don't know yet, or we didn't know we knew. So functional subgrouping helps exploration. And then if one person goes as far as they can, someone else might take it further.
So I want to just slow down there for people who don't have the experience of SCT, of an SCT group. This functional subgrouping is something that's the opposite of, say, the stereotypical subgrouping.
Absolutely.
Of surface similarities.
That's exactly right.
And
so you don't scapegoat. You see.
Don't scapegoat.
In stereotypic subgrouping, there always is an us and them, or a me and you, and it's a push away of the people that are different.
Yeah.
But functional subgrouping depends on building on similarities and gradually incorporating differences.
So let's stay there for the similarities for a moment. Just I want to maybe start a little picture, mental picture for people who are not familiar with it. So in an SCT group, you would encourage a person who speaks. Afterwards, you'd say, who else? And people would have the option either of resonating with a person who speaks,
right,
or of starting something different.
Well, if they're going to start something different, they do something first. They say to the group, is the group ready for a difference?
Okay.
And if the group is ready, they'll say yes, which means that the group can actually listen to the new topic or subject.
So there is a very clear structure of the encouragement of resonating with something, not muddying the water by everybody putting in different voices.
That's right.
And with the understanding that the group is going to be a container, that everything can be heard.
You've got it.
Okay.
It's yes and rather than yes but. See, yes and builds.
Yes.
Yes but is diversifying.
Yeah.
So I can say a token, yes, I really understand you, but I've really got a better idea which is quite different. See? Or, yes, I'm going to apparently relate to you, but actually I want to go on with my monologue.
Right.
Okay?
Right.
So we very rarely use the words yes but much more important, we don't do the things that a yes but does.
Yes.
So we join rather than separating.
And so that there is a very, very clear indication of what it's like to resonate. And so as you build a subgroup, you're going to have a strong sense of people feeling the same way, and you have that really well established, at which point you ask the question and another subgroup can form. And there is a sense that the group can tolerate.
Well, you see, what happens very soon, once you do subgrouping, is that people start to feel good because they feel understood, and they develop confidence, and they develop security. And so therefore the ambiance or the norms of the group are very favorable to being able to speak up and to take risks and to say things that you might otherwise not say or be shy of saying. So what happens very soon in functional subgrouping is that the group develops a climate that is very supportive of being yourself and being authentic and being real.
Yeah. So, and I think another part is that that makes it different from stereotype grouping is that you can have somebody angry at another person, but the two can be in the same group.
Absolutely. It very often surprises new people when they want to get into a fight and you point out, well, you're both in the fighting subgroup. But there's something we've missed.
Yeah.
And what we've missed is the theoretical underpinning of functional subgrouping, because there is a rather important, impactful hypothesis in SCT, and that is you only need to know one dynamic if people are going to survive, develop, and transform. Okay? And that dynamic is the ability to discriminate and integrate differences.
So tell me more about the ability to assimilate and integrate the differences.
Well, first you have to recognize that there's a difference, and you know what the human response is to difference. It attacks it, or scapegoats it, or pretend it doesn't exist.
So that's where the avoiding the yes but is a way of avoiding anything that dilutes the differences so that you can face them squarely?
No, not quite, because the yes but is a difference, you see.
Okay.
But what we want to do is to bring differences in such a way that they can be heard and integrated.
Okay.
So what we do by functional subgrouping is people come together on similarities. And as they're working together, they notice just small differences in what they're saying. All right? So somebody might say, well, you know, when I get a sensation in my stomach, I find I clench it. And someone else will say, it's funny you should say that. When I get a sensation in my stomach, I ignore it. Now, there's a difference there, but what the similarity is that they're exploring their response to a sensation in their stomach. As people gradually bring in their own stuff, there are small differences. But those differences are small enough to be integrated into the subgroup. Okay? Then someone says, I have a difference. Can I bring it in? And the group says yes. So they might come straight along and they'll say, I'm really not interested in physical symptoms in the body. What I'm much more interested in is what I can do with my thoughts. Okay, now that is a real difference. You see, it's also an either-or.
Right.
And an either-or is very divisive, very diversified. So then the people who are interested in exploring what happens when they do their thinking, like they might explore negative predictions causing anxiety, when they start to explore that and they get the small differences, that subgroup learns to integrate differences. Okay. Now, as the two subgroups swap backwards and forwards, when one subgroup runs out of energy, the next subgroup starts. When that subgroup runs out of energy, the first one goes again.
Yeah, I think it's important to remind people that all of this happens within one session.
Oh, yes.
It's not, because in defining that's not something that happens over it really happens in one session.
Absolutely.
And the people are in the same room, they're part of the same group.
That's right.
They're all sitting, for instance, in a circle.
Yes.
We haven't moved people physically together.
No.
But just there's a sense of, in a way, it's the same thing as when you see the parts, these diagrams of the brain with parts being lit.
Yes.
That you have
exactly
the people of the subgroup. It's like the
exactly.
Yeah.
So then the group is the container of the differences. And in the meantime, as people are subgrouping, they're learning to discriminate and integrate differences. And then there comes a point where there's a spontaneous recognition that there are similarities between the apparently different subgroups. And then an integration takes place in the group as a whole.
Yeah.
So, for example, they might say, oh my God, do you know what? The way I think and the way I feel is actually related. And if I think, I can generate feelings. And if I feel, I can find words for those feelings. But those are actually two different processes. See, and they've integrated and understood something that they didn't understand when they first started.
Yeah. And this has happened by processing similarities and difference.
Yes.
To the point where within the group that's similar, more differences appear.
Yes.
So that as a result, there's more similarities between the groups that were dissimilar.
Right. So the full theoretical statement is, by discriminating and integrating differences, that means by noticing differences in what is apparently similar and similarities in what is apparently different, the system survives, develops, and transforms from simpler to more complex.
Yes.
It's a mouthful.
It is. But in a way, the image that I have with it, as you describe it, is it's the same thing as the way we process food by cutting it into small bites.
Yes.
And then the big chunks are more easy to assimilate.
But if it was a subgroup, you see, it would be all the root vegetables got cut into chunks, and then carrots, and then some turnips, and then some parsnips.
Right.
Okay? And then all the things that were not root vegetables, like peas and beans, and maybe some lettuce. See? And those would be assimilated, and then pretty soon people would be eating all over the plate.
Right.
Because those differences would not be worrying.
Yes. So that's they start being very different.
Yes.
And then they end up all being food.
Yes.
Yeah. So I want to come back to the part about, you say, when you're describing what happens in the subgroup, and say, well, something happens in my stomach, or something happens in my chest. So let's talk a little bit about that, how you pay attention to sensation, and how you handle it.
Okay. In the subgrouping, let me see, there's a major difference here, which is what we emphasize, that emotions are physical. So that with every emotion, there's a physical component. And that is different from, we discriminate between emotions and feelings. And the feelings are the words that we give to an emotion. But once we've given those words, we can think them, and when we say those words, we can also generate the feeling, whether or not the same thing is happening or not. Okay? For example, something really bad can happen, and someone can say, well, the word for that is I feel overwhelmed. Okay. And that word is satisfying, because it's almost as if one has come up with a container for the experience which represents the experience, and it's a relief to find a word, a feeling word that describes an emotion. The difficulty is that one can then start to talk to someone in a story, and they can talk about being overwhelmed. They aren't actually overwhelmed, but the word generates the same feeling.
Right.
Okay?
Right.
So you have two sources of feeling. One is the real sensory, emotional experience that comes from the relationship between the body and the outside world, and the body and the inside world. And you can also have feelings that come simply from the way you think.
Right. So in kind of a virtual reality process. Yes.
So what we do, as we've mentioned before, we make a big distinction between explaining and exploring. So when, for example, people have muscle memory or experiences in the body that come from past experience, which then get repeated in the present even though it doesn't exist, because with the brain, memories, the brain doesn't know the difference between a memory and an actual episode in the present. The brain has the same experience. So when we recall a past experience, we may have the same experience even though it's not happening now.
Right.
Okay. So it's in the process of teaching the mind to discriminate between those two things, and then being able to understand what the messages are from the body and what they mean. So if one gets a stomach ache, it may be that one is scared, and that one is bypassed and has sent that fear into the body so that one gets a stomachache when one is scared, or what gets a stomachache when one is angry because one's afraid of the anger, you see. Or it may be that one gets a stomachache because one's eaten something wrong.
Okay.
Or one gets a stomachache because something is really wrong with us. So it's important to be able to discriminate between a signal from the body which has to do with now, and signals from the body which have to do with the past.
Right. So that's a very important part of just realizing that, our instruments basically blind us to that.
Our instruments.
The brain, that you say that as, something from the past. We're not able to discriminate whether this is something that's happening or whether that's something...
The brain can't, but our mind can. I mean, we use the... And there's a lot of controversy about this, so let me be clear how we use it.
Okay.
We use the brain as the physiological sort of programming function. Okay. And the mind as something that one can use to learn to interpret what happens in the brain.
Right. So, through teaching the mind and training the mind...
Yes, to be observing. It comes the possibility of discriminating. Yes.
Whether the experience is something that responds to the environment
or one's inner environment.
Or whether it is something that is simply reconnecting to
a past
memory or a past...
Or it may be that one gets the idea and gives oneself the symptom.
Right. So, could you talk more about how you train to recognize that?
Yes. Let me think for a moment. Well, the big thing is we start with recognizing the difference between the past and the present. And we also train for recognizing roles. Roles are systems, and each role has an experience. So, for example, the roles right now are you're the interviewer and I'm the interviewee. Okay. Those are two different roles and they exist in the present. Okay. We're also friends. Okay. Those are different roles. And we have past memories of those roles. So we feel good about each other in the present. Although we actually haven't earned enough in the present to feel good about each other. You see?
Right.
Okay. Although we feel as if we have because of the past. All right. So, why would it be important to know the difference there? See? The difference would be that it's not enough for us to be friends in the past. We have to be aware of each other. Are we playing useful roles in the present? Am I being a good interviewee? Are you being a good interviewer in relationship to our goal?
Yes.
Okay. Now, if we import the friendly feelings, we might not be clear enough about what we should be doing in terms of our goal right here and now for the goal. Okay? Then the other thing is that we make discrimination between two very important systems. The system of the person and the system that relates to being a member of an outside context. So you and I are members of outside contexts.
Yes.
Okay. And we have clear goals, and our behaviors, ideally, are oriented to that goal. Okay. Now, inside ourselves, we could import a role relationship which wasn't useful. Okay. For example, in all of us, there is a dominance and a submission. Okay. If I imported either a dominance or a submission, I'd be inviting you to take the other side. Okay? So we might end up with you bullying me, or me frustrating you. And that wouldn't be to do with our roles here. It would be to do with some look-alike in the past that we have imported into the present. Now, the difficulty in doing that is if we import a role from the past, we have the full experience of what it was like in the past, and we get partially blinded to the present.
Right.
So we only pick up the information in the present that fits with our experience in the context in the past.
So let me just maybe give a little bit of a summary.
Yes.
And see if I capture this. In a way, the image that comes to mind is as we are having a common task, there is a commonality of purpose.
Yes.
And so there is clarity
yes.
around
and
that.
Also choosing behaviors that would fit now.
Right.
Like you just used a questioning behavior, and I'm using a reinforcing behavior by saying yes, yes.
Right.
That's appropriate in relationship to the task.
Yes. So in a way, it's related to the concept of orienting.
Yes.
As we have a goal,
yes,
we see it clearly,
yes,
and we adapt,
yes,
in order to fulfill that goal. So
yes,
we're in alignment, and that's
yes,
that falls into place.
Our language would be that our behaviors are a vector towards the goal.
A vector towards the goal.
And they come from a role. And we select from that role those vectors that are appropriate to the second.
And the role is appropriate to
right,
the goal and to the situation.
Because it's in the present.
But if, on the other hand, we import from our past history a role that has nothing to do with the present and with the goal, then we're muddying the waters.
We can. On the other hand, supposing I've had a history as an actress somewhere else, see, then I could import the ability to act into this, and it might be helpful. Or it might start to be artificial. So we wouldn't really know, as we import a past role, whether it's going to be helpful and part of a present work, or whether it's going to get in the way. And the only way that we can tell is by paying attention to the effect of what we do on the present circumstance and the vector towards the goal.
And that's where we come to that observing quality.
Yes, which we call the self-observing system.
The self-observing system.
Different from the ego.
Yes. So let's talk a little bit about the self-observing system, maybe something like mindfulness.
No.
Okay.
No. The self-observing system is the ability, the developing ability to discriminate and integrate differences. So it's like a mini subgroup inside oneself. Discriminating and integrating differences so that we can behave appropriately in the present.
So, for instance, how does it, let's take, we take the example of a conversation, interviewer, interviewee.
Like us, yeah.
Right. So, where does the self-observing system help us pay attention to our roles and to the in relation to the goal?
Well, what you're doing is you're keeping an eye on the voice level.
Okay.
Okay. Your self-observing system has to discriminate whether it's similar enough to what we need or whether it's too different that it requires adjustment.
Right.
It's your self-observing system, like your researcher. See, a more popular word is researcher.
Yep.
Okay? And you have to be using that part of yourself in order to monitor our behavior. Okay? So you can signal to me to change my relationship to the microphone.
Right.
Okay? Which I just bumped with my nose. That signaled me. My self-observing system noticed that I bumped my nose on the microphone,
right,
and therefore I needed to change its position.
Right. So then there is this dialogue, so that sense of subgrouping inside.
Yes.
And while there is an overarching function that's a larger goal, there are smaller goals that these different subgroups are dealing with. Yes.
Okay.
Yeah. So let's come back to the isomorphy in the sense of, this physical sensation.
Right.
And the explore, don't explain.
Yes.
And for instance, I think one of the things you do is to encourage people to contain and not to act out.
Yes.
So let's talk a little bit about the impulses and, the containing and exploring.
Let me give you a really good example. Because I was working with someone who did a lot of massaging his arm. And as we were working, whenever it got tense, he'd massage his arm. So when we had a good enough relationship, I'd say, have you got any idea why you're doing that? And he said, no. So I said, well, are you interested in seeing what would happen if you didn't do it? And so he said, yes. So then he said, well, when I don't do it, I get very tense in my shoulder. So I said, well, what happens when you do it? Well, the tension in my shoulder goes. So I said, well, are you interested in knowing what the tension in your shoulder is about?
Mm-hmm.
So he said, yes. So I said, well, would you describe it? And he said, well, it's sort of a pinching here, and it's in both shoulders. And I said, okay, have you got any idea what that might be? Anything like that ever happened to you? And he said, no, I don't remember. He said, I do know one thing. He said, my mother used to grab us by the shoulders. Now, I don't remember her doing that to me, but I've seen her do it with dogs, and I've seen her doing it with my younger brothers and sisters, but I don't remember it.
Mm-hmm.
Okay?
Mm-hmm.
So his shoulders remembered it.
Right.
And then we went on working with what that meant for him and what that meant in relationships and et cetera, et cetera. So what he had there was he had a displacement activity from the feeling in his shoulder.
Mm-hmm.
His feeling in the shoulder was tension and pain. What it meant to him was that he was being grabbed, and his whole whatever he was doing and whatever he was wanting was interfered with. Then it transferred to, if someone didn't agree with him,
right,
he would stroke his arm, because what was happening for him was he felt he was being grabbed. He got painful tension in his shoulders, which he displaced onto his arm, which he could then soothe. It was very moving, actually. Very, very moving.
Yeah.
So there is a beautiful example of muscle memory, which is out of consciousness, related to a role with others, related to the defense against the pain of, not so much the pain in the shoulders, although that was physically painful, but the pain of the disruption of being able to be himself.
Right.
So it was just a beautiful example of how the body and how his relationship to what was happening in his body managed to soothe himself in the present, but at the same time kept him distant from anybody by whom he felt grabbed.
Okay, so in a way, this is a way of you see that as a way of importing that episode from the past into the present through the physical sensation.
Absolutely, and there's an awful lot of that. You know, our posture. The other thing that is physical, there are different postures that go with roles, and if we're not aware of them, we send out a role signal which invites the reciprocal response. So, for example, if I sit back and look down my nose at you with my arms folded and my legs crossed, you're going to feel either the impulse to fight me and put me down, or you're going to feel the impulse to go one down and be sort of humbled.
Right.
Okay? If, on the other hand, I look at you up under my eyebrows, you know, duck my head down and look up under my eyebrows, you are either going to want to look after me, or you're going to want to get rid of me because I'm a nuisance. So our role postures in our body stimulate other people to take the other side of the role posture.
Right.
And we call that role locks. Now, those
role locks.
Yeah, you get locked into a reciprocity of roles.
Right.
So what we try to do is to become aware of our behavioral postures, which then gives us an insight into we are repeating a role. And the same is with our voice tones.
So I want to just say there, because in a way, this is something where, as you are aware of your posture, what's interesting is not just to see it as posture or even to see it as something that you inherit from the past, but to see it as actually something in which you are unconsciously active in creating something among other people.
Yes, which will give you a look-alike to what happened in the past with someone else.
But so it's a way of restoring a sense of agency, because instead of just simply feeling passive about this role, you discover that it exists and you have the possibility of undoing it.
Yes, that's right. And you can stop inviting people to either bully you or go one down to you or etc., etc.
Right. So very much a sense of you're not just looking at your person system or looking at you and your parents or your but you are seeing how changing that understanding of your person system can change your interpersonal system with other people.
Absolutely. And there's another aspect of that, which is listening to one's voice tone. If one, for example, if one starts to hear oneself talking, well, I'm so frustrated about that, and look what they're doing. Do you hear the voice tone?
Yeah.
You see? Now that voice tone tells you you've gone into a victim role.
Okay.
Or you get sharp and you say something like, well, I don't know why you did that.
Mm-hmm.
Okay, you've gone into a dominant role.
Mm-hmm.
So after a while, it's not as if you're really listening. It's like on the back burner, there's an awareness that your voice tone is flagging something.
Right.
That you don't really want to act out. So then you recognize that the voice tone is signaling that you've gone into a role, and that the role is inviting others to take the other side, and that you're now in a repetition which is not good for you, and which you don't really want to be in.
Yeah.
And you also notice how seductive it is to go back to those old roles.
Because there's a groove.
Yes, there's a groove.
Yeah.
Yes, there is. Well, all of that is done in subgrouping, you see. And the longer the groups together, and the more subgroups work, the more unbearable realities about us become bearable, because they're shared, and they're human, and they're common. So after a little while, one can look at one's sadism, one look at one's masochism. One doesn't necessarily use those words.
Yes.
One can look at the impulse, the murderous impulses we have when we're frustrated, which previously we may not even have been aware of, and just turn back and become depressed. So with functional subgrouping, over time in a group, there's really nothing about being human that we can't explore, including really difficult things like what would it be like to be a commandant in a concentration camp? Can one explore the part of oneself that might have done that efficiently, which is a horrendous idea if you've just begun it. But if you move down the pike, pretty soon you are able to resonate with and understand all the ways that human beings behave without scapegoating them.
Because everything that is in you exists also outside.
That's right.
So
and everything outside exists in us.
in you, in us.
Yeah.
So there's no sense of, there's a sense of support for exploring it.
And the both the admiration and triumph and the pain and horror of being human. It's important for us to be fully human. The fantasy is that if we worked more like this, we might be able to do something about the way that we are so wedded to wars.
Yeah.
And so wedded to violence, and so wedded to pogroms and things like that. Because as human beings, we keep acting that out over and over again. We keep making it them and us.
Yeah.
Us and them. And
so
that's the hatred we have of differences, which is why we come back over and over again, that instead of scapegoating differences, one has to learn to discriminate them, understand them, and integrate them, instead of scapegoating them.
Yeah. So scapegoating them within the context of a group, and within the context of oneself, and within the context of society at large.
You got it. You got it.
Yeah.
It's very, very hard work. People who are in training in SCT, it takes a while. It takes quite a long while. And it takes a lot of work. But you know what I found, because I started as a psychoanalyst. So in my early days as a therapist, I was aware of how much human suffering there was. And also there is some suffering in watching that much suffering.
Yeah.
Since I've worked with SCT, people get to the same place, sometimes deeper than I was able to get them as a psychoanalyst, and often much more broadly, without that same level of suffering, because it is done in a containing, empathic, attuned subgroup. So it's bearable. What was hardly bearable for some of my patients on the couch, I don't see that happening in working with SCT. things are unbearable.
So I want to just make a distinction here. When you talk about SCT, do you talk in this case about SCT as practiced in a group, or also SCT practiced in individual therapy?
Yeah. And with oneself.
Mm-hmm.
So it's in a group, in an organization.
Mm-hmm.
See, for example, if you take an organization, your team, as part of the department, as part of the organization, each of them have the same issues to deal with.
Mm-hmm.
Although because their contexts are different, their issues will be different, but the way they need to deal with them will be the same.
Mm-hmm. So I'm coming back from there to what you were saying about how SCT makes it possible to come out understanding or dealing with one's problems
with
less
human problems.
Human problems. Yeah.
With less pain. That's my impression.
Mm-hmm.
You know, I believe it's true because that's my experience with it.
Mm-hmm.
Other people may find it different from that.
But one of the things I see in addition to the theory itself, that one of the flavors, one of the things that SCT, that you have given to SCT, is a sense of a poetic sense almost, with expressions, when you talk about something like sitting at the edge of the unknown, explore, don't explain, there's kind of a quality that even just that language is a way of taking somebody out of the familiar role of I'm suffering.
Yes. The other thing we do is we don't diagnose.
Mm-hmm.
I mean, we do diagnose, but we don't use diagnostic labels which can be felt as pejorative.
Mm-hmm.
You see? So we don't do that. We use much more driving and restraining forces. What's getting in your way from meeting your goal?
Mm-hmm.
See, and what's the drive? And the idea, very important from Kurt Lewin, if you reduce the restraining forces, the drive towards the goal just naturally moves on.
Right.
So if you reduce the restraining forces to survival, development, and transformation,
mm-hmm.
the drive just automatically moves towards development.
Mm-hmm. So there's a very, there's a sense of, there's almost a built-in sense of movement, that's there.
Yes.
Which in a way that, when you talk about other forms of therapy is not necessarily there.
Well, I think it's there in its own way.
Mm-hmm.
We've just spent a lot of time finding the language, finding the attitude, recognizing that the only difference between the patient and the therapist is the role.
Mm-hmm.
Okay, that the role of the therapist is to get training so that they can help the patient explore and discover what's in the way of them getting what they want.
Mm-hmm.
You see? So there's a little buzzword we use. Me structure, you energy. So my job as a therapist is to provide the structure. Your job as the patient is to use my structure with your energy to get what you want.
Mm-hmm.
Because my structure are a series of hypotheses that if you do this, it's easier to get that.
Mm-hmm.
See? So we are very clear about structure, like all our groups use functional subgrouping, whether they want to or not.
Mm-hmm.
If they don't use functional subgrouping, they can't be an SCT group, because the process of an SCT group is to discriminate and integrate differences instead of scapegoating them.
Yeah.
Okay? So me structure, you
energy.
me giving you the fork in the road of choice,
mm-hmm.
you making any choice you want except the choice of not to choose.
Mm-hmm.
Okay? So the structure is very clear. You've got to choose.
Mm-hmm.
But which way you're going is entirely up to you, whether I think it's the right way or not.
Mm-hmm.
My opinion is no good.
Yeah.
My structure is where it matters.
Yeah.
So you function as structure.
So that's a good way to put the sense of creating a structure and and embodying it. And as you do that, it's something that happens between the leader and the group, or between the therapist and the patient,
Yes.
but also then gets absorbed by isomorphy
Yes.
inside
Yes.
the individual.
Yes. For example, the time boundaries, the structure of time. We try to start and stop on time. Now, starting on time is one of the hardest things for a group, particularly a big group, you know. And the groups that don't start and stop on time have a different character. Because if they don't start on time, nobody really knows when it's going to begin. So it starts later and later and later. And if it doesn't stop on time, people never know whether they're going to be able to put their nickel in the parking. Sorry, that's age. A quarter in the parking, the parking machine. So we are very clear about the structure of space and time. Okay. Mostly, groups that we work with come on time and leave on time. Now, over time, that starts to erode, and we have to re-establish the structure. But something that interests me very much about, for example, what happened in a fairly recent group of about 20, 25 people who've been working for 5 or 6 years together, some coming and going, new members coming, others leaving. This semester, the group decided that it wanted to give presentations. Rather than having the first hour be theory in which I would give them the theory and they'd discuss what I gave them, they decided they wanted to do presentations all by themselves. They organized themselves so that 2 people did a presentation every session. You know? I've never seen that. I've never seen a group of people decide that they want to give themselves the and they're doing beautifully. Absolutely beautifully.
So was it a group that had passed the authority issue?
Yes, yes, it was a group that has done the authority issue.
Right.
Yeah.
So I think as we are, do you want to find a way to end?
I'd like to put one more thing in, which
Sure.
is that the phases of system development, if one knows what phase the system is in, one doesn't give the system things that it can't do. So, and of course, it fluctuates, you know. A group may have gone all the way through to the work phase, but may, for a period, work in a flight phase, you see. So if you adjust what you require, what you're putting at the group to solve, the goals of the group, if you adjust those to what the group can do, there really is not much of a failure experience. And you can always keep reducing the restraining force in that phase so it can move to the next. So understanding the phases of system development is a very relieving thing to do for a therapist. Because the therapist doesn't have to be so bewildered about what the group is doing.
Right, so it gives the therapist a structure, and there's a context, paying attention to the context, and the theory functions as a structure.
Yes.
So that in a way, the therapist is not alone with their group, but is held by the larger group of the experience of SCT.
That's exactly right. That's exactly right. And we have a little, no, it's quite big actually. Any member of SCT can call up a licensed member or an experienced member for a 10-minute consult on the telephone. Anytime they want to. And if the person that they've called up has the time, the energy, and the resources, they'll do a 10-minute consult. So nobody is alone in SCT. We also do an enormous amount of work on the bridge, which is the ability to phone in and have a conference call. Because we are so spread over America and also in Scandinavia and England, we do a lot of work on the telephone. And we thought that was going to be very difficult. But in fact, one knows the voices, and one can hear when someone's gone into a role from the voice tone, and we can ask them, are you suddenly in a role? So we do a lot of work in lots of different ways, making contact with each other when we need to, as well as the formal get-togethers on the conferences.
The conferences,
yeah.
Good. Thanks, Yvonne.
You're welcome.
This recording is part of the podcast at relationalimplicit.com.
SCT.
Mm-hmm.
We also do an enormous amount of work on the bridge, which is the ability to phone in and have a conference call. Because we are so spread over America and also in Scandinavia and England,
Mm-hmm.
we do a lot of work on the telephone. And we thought that was going to be very difficult. But in fact, one knows the voices, and one can hear when someone's gone into a role from the voice tone, and we can ask them, are you suddenly in a role? So we do a lot of work in lots of different ways, making contact with each other when we need to, as well as the formal get-togethers on the conferences.
The conferences, yeah.
Yeah.
Good. Thanks, Yvonne.
You're welcome.
This recording is part of the Proactive Mindfulness podcast. We explore how to be more present and engaged in our lives and how to make lasting change. This is a contemporary take on mindfulness, informed by embodied therapy and the polyvagal theory. You can find more articles and videos on the website proactivemindfulness.com.